Do you ever hear the phrase red meat and wonder what that actually means? Oftentimes, health guidelines will talk about decreasing intake of red meat, but what they're referring to is the decreased intake of mammalian muscle meat. It includes things like beef, pork, lamb, veal, mutton, horse, and goat. In terms of the research behind this focus on a decreased intake, it mostly has to do with the risk of cancer as well as the risk of cardiovascular disease. So there is some association between higher consumption of red meat and increased risk of colorectal cancer. However, this is more of an association as opposed to a causal relationship. The relationship that is a little bit more established is the relationship between processed meat and increased risk of colorectal cancer. So processed meat is things like hot dogs and deli meats, ham, etc. Red meat typically also is a fattier cut of meat, which means it has more saturated fat, which we know is associated with elevated LDL cholesterol levels, which could increase risk of heart disease and stroke over time. So overall, there could be a benefit to decreasing red meat consumption, but that might look different for each and every individual. So for example, somebody who really enjoys red meat, maybe starting off with having one less serving per week and instead switching to something like a plant-based protein or a leaner meat like chicken or turkey could be a great goal. Ultimately, I think more research needs to be done as to the health effects of red meat consumption, but it does seem like there are some health promoting benefits to decreasing our overall consumption of red meat and processed meat.